I'm still a little bit curious, I am. Why is it that women suffer with fibromyalgia more intensively and more cases than men? It got me thinking. It did. In my previous video, that is, on this topic. And it got me thinking about hormones. Strange, I know. Why hormones? Right. The thing is, well, the fact is, I suppose, that the CDC, the American Health Organization, well, that states that women are, well, twice as likely to suffer from fibromyalgia than men. Now, women also have more tender points. There are more places in the body which provide pain and discomfort, or other conditions such as brain fog and stuff like that. Now, the other thing is the intensity of the pain seems more severe in women. So many women with fibromyalgia, they end up in a wheelchair, or they just can't function that day and they stay in bed. Although I know women like to do that anyway, but there you go. No. It isn't very well understood, is it? No. It's not completely understood at all, to be honest. Why women suffer from this condition more than men. But there are a few theories out there, and there's a few of my own as well, Now, one theory is that fibromyalgia is brought on by hormonal changes, and that kind of makes a lot of sense to me. After all, women, well, they can have children. They go through hormonal changes when they have children, for the childbearing years and what have you. And PMT, so, and menstrual cycle, yeah, I suppose that to it as well, isn't it, So I'm just brainstorming here, but it just makes me think a little bit more of it, because although I've got fibromyalgia, the people I've been talking to about it is they're suffering way more than I am. And then, oh yeah, I'm a windy woman or something stupid like that, some arrogant, misogynistic comment or whatever, or reasoning. No, it's just that their condition is literally more severe. It incapacitates many women more than it does men. I suppose you got the fluctuation of estrogen and what have you, and progesterone, and all this could potentially, I suppose, contribute to fibromyalgia symptoms. But the one biggest thing that comes to my mind is the childbearing years, pregnancy. Now, it does cause significant changes in hormones, making it even more likely for you to suffer with the symptoms. It could also be that trigger. Some people say childbearing, it completes your body and all that sort of stuff. But it also puts your body under a huge amount of stress for a woman. Now, women are more likely, I suppose, to suffer from other mental health problems as well, including anxiety and depression, although I suffer with those. Maybe I'm a woman, I don't know. Now, these factors, they clearly contribute, don't they, to the development of fibromyalgia. I don't think there's any real argument there, is there? And it's making women more likely to suffer from the disorder. Blimey. I'm just trying to brainstorm here, because I suppose the more we talk about it, the more we think about it, the more likely we're going to have an understanding. And without that understanding, the knowledge, we're never going to get anywhere, are we? We're never going to find a solution or a reasoning, because everything is linked. End of the day, When men get fibromyalgia, women get fibromyalgia, they're just different degrees of, and maybe we can learn more from the women to help treat the men as well, or vice versa, you know. At the moment, we're just having to manage fibromyalgia once diagnosed. Ways of controlling and dealing with the symptoms of fibromyalgia, because it is a lifelong disease. Once you got it, you got it. You know, there's no going back on it. There's no magic cure or pill or whatever, is there? You know, you're just gonna have to learn to deal with it, manage it. My symptoms are early onset. It's not I'd say I probably had it for 6 years, I suppose, in varying degrees, but progressively got a little bit worse. But still, I know it to the level that I'd say most fibromyalgia, female fibromyalgia sufferers, no in there. So you've just got to kind of like try and manage all these flare-ups, and and sort of try to live as comfortably as we possibly can. But it's multifaceted. Now, you could say, there's all these different therapies and what have you. You can, like chiropractic adjustments, medications, and massage therapy. All these things are more about relief. It's not cure or prevention. It's more about relief. Well, I say with prevention, I suppose stress management certainly does help. Not allow things to get to, because it definitely triggers episodes. I don't know, it's just, I think this is going to be an ongoing story, isn't it? Why women and men's degrees of fibromyalgia differ so greatly. It's not by little either, is it? Not by a lot. No. It is considerable. See, for me, with fibromyalgia, the things that I suffer with most with it is a loss of concentration. Trouble concentrating, that brain fog, fatigue, constantly tired, my eyes constantly tired. You see all these hormones that affect your muscles, and your muscles are used throughout your body to do various things, whether it be, I don't know, your sphincter and esophagus and what have you, to control Gordon, so whether or not you're going to be bringing up excess acid. Well, then, if that's not pinching down properly and sealing off, whether you're going to bring acid up, cause burn and ulcers and all sorts of stuff. So many different problems. And then you've got the generalized pain. Then you've got the muscles in your eyes and muscles. You've got muscles all over your body, in you know? And they require hormones and to actually do their job. And if one hormone isn't right, many of like the thyroid, whatever, it produces a hormone which then gets made into a different type of hormone somewhere else in the body. If that wasn't right, that ain't going to be right. So it can cause problems throughout your whole system. It ain't easy. It really isn't. And I've only just been diagnosed with it, so it's like I'm learning at the moment about it. It doesn't make it any more comforting, does it? So hopefully we do. If we progress in a way where we carry on learning, and pharmaceutical companies, etc., and those doing the tests and what have you, examinations, and actually keep on getting the funding. Because if there's no money in it, no one's going to do anything, are they? They're not. We'll get nowhere. Toodaloo.